Well, hello everyone. Welcome back to another live hangout here at Voice Essential. It is so good to see you, and it is so good to see Mackenzie Kate back in the live chat. It's good to see you, Mackenzie. I had wondered where you had got to because I haven't seen you in the live chat for a number of weeks. So it's good to see you, and thanks for joining in the conversation. I can also see, of course, I can see Linda, and I can see Mr. Fomiati, and Mila, who was in my studio at 9 o'clock this morning. So it's good to have Mila jump in and join us as well. Today, it's a conversation that I've been preparing us as a community for a few weeks. I'm going to be, in a moment, welcoming Dr. Claudia Friedlander onto the show. And I want to just remind us all that today's discussion is going to be around the subject of cancer. Claudia will tell you her story in a moment. But in keeping with the discussion, I know that the topic of cancer and serious illness can be quite a triggering one for some people, understandably. And so I want to just let you know up front that that's what we are going to be talking about. If this is a conversation that you yourself, is going to be a difficult one, this may not be, oh, look, I want you to watch the show, but equally it may not be the right one for you to watch. And so I want you to make the best decision for you in that regard. We are going to be discussing this topic with as much sensitivity as we can possibly muster. I also just want to let you know that I've asked Linda, who all of you know moderate the live chat. I've asked Linda to delete immediately any medical advice that is offered in the live chat. We are not medical practitioners. We are singing teachers. Both of us have doctorates, but they're academic doctorates, not medical doctorates. And so we will not be offering any medical advice. Additionally, though, I also need you to know that Linda will also delete any anti-chemo, I'm going to call it garbage, because we will talk about chemotherapy today and the impact that it's had. And both Claudia and my wife have undertaken the same, from what we can figure, the same regime of chemo. And so we're going to be talking about that in as much as you can talk about chemo in a positive light. There's certainly no anti-big pharma in this discussion. So all of that is going to be culled in the chat immediately, and I just want you to all know that's up front. Without further ado, I want to get into the conversation because I think my hope is that our conversation with Claudia today will be one of encouragement to you should you find yourself or currently be in a similar challenging situation from a health standpoint. Let's get into things and let's start the conversation.
Sound check. Check 1, check 2.
Hello, Dr. Claudia Friedlander.
Hello, Dr. Dan. It's so nice to be here with you, all of you.
It is good to have you on the show again. Of course, we had you. Do you know what? I should have taken a note of exactly how long ago it was, but it was a little while ago. The reason we had you on the show last time, we were talking about fascia, that connective tissue. I don't know if you can recall that, but we're talking about, because your background is one of physical therapy and training people physically, but of course you're also an accomplished singer and singing teacher. But they're all good reasons to have you back on the show to continue that conversation. But we're gonna kind of take a tributary, if you will, of conversation today to talk about your recent experience. And when we talk recent, like it's super recent, your recent experience with colon cancer And aside from my personal interest in your well-being, I have a shared experience because, and many of the people a part of our community know this, that my wife too had colon cancer, and that was coming up on, well, I think we're 7.5 years post, but yours is far more recent than that. Can you tell us about your story?
It's hard to know where to start, but on January 3rd, 2024, I landed in the hospital for 3 weeks very, very unexpectedly, and was diagnosed with colon cancer. I had shown up to be checked out because I was having some problems, some pain in my hip that turned out to be an abscess. There was some swelling, and it was very interactive with the self-myofascial release work that I had been doing on my hip and lower back, which was the area that I had been working on. It ended up being completely unrelated to this. But I went in and I thought they were just going to give me some antibiotics to resolve whatever it was, but they did some imaging and they discovered that the reason that I was having this swelling was because I actually had a tumor in my sigmoid colon that had perforated the abdominal wall and caused the problem. And then with further imaging, they discovered also that it had metastasized to my liver. So I went from just thinking I was a normal person walking around living my life to being in the hospital for 3 weeks to basically being in bed for almost a year. So that was a big surprise. That's where it starts. Do you want me to continue? Or
it's, isn't it? And you and I were talking pre-show. It for our experience, and I hope you don't mind as we go along in today's discussion. I'll continue to interject some of my lived experience as well. Jody was very. We felt like we were T-boned, like it was completely unexpected, and that's part of the life jolt, if you will, of these kinds of experiences. Like you made the comment, cancer wasn't on your bingo card.
no. No, what I was joking with Dr. Dan earlier that like whatever the thing is that you're really freaked out about, that you're worried is going to happen, that keeps you up at night, it's going to be something else that gets you. Because I had plenty of things that were a source of anxiety for me, but cancer wasn't one of them. I enjoy taking care of myself. I enjoy eating well. I am a fitness enthusiast, and I feel like it's even more important for me to walk my talk. When I talk to other people about fitness and nutrition, I can't expect them to take me seriously if I'm not walking my talk. And so I thought, oh, well, this is really shitty for my brand. No, I've got cancer. But the thing is, colon cancer is a very slow growing tumor. I'd probably been making this for up to 10 years. And there had been stressful experiences in my life recently that possibly contributed, certainly didn't help.
Yeah.
But if you get cancer, don't take it personally. This is something that can happen to anybody, no matter how well you're taking care of yourself. The important thing is if you find out that you're dealing with cancer, just learn as much as you can about it and access the best care that you can get.
We used to say that if you were to line up all of our closest friends of similar age to us, Jody, my wife, would have been the last person you would have picked out of that lineup to be the person to develop colon cancer. And we too could see when Jody went and it was discovered that she had the cancer. She was going because they expected to diagnose her with something like celiac or Crohn's, which also wouldn't have been great outcomes, but certainly may have been less impactful than a colon cancer diagnosis. It just came out of the blue. It was completely unexpected, but we can look back on photos of Jody from the 2 years leading up, and you can see this slow but certain, like she's just looking less and less well, but it's such a slow burn this disease?
And that was very much my experience as well. Uh, Looking back on it, I can see that there were signs. There were signs.
Yeah.
There was, in retrospect, a rather extreme weight loss that I was not planning.
Okay.
Prior to that, there had been a rather extreme weight gain that I had just attributed to being sedentary during the pandemic lockdown and going through menopause. And then after life started up again and we started being able to do what we wanted again, and I started losing weight again, it didn't really seem like it was that big a deal. But in retrospect, looking at the way that I just was in my body and the fact that the weight loss, I didn't even really notice it, was that I was getting less and less interested in food. I can tell you that an upside is right now, I feel like my digestive system is functioning better than it ever has in my life. So obviously the cancer wasn't responsible for all of that, but it's a great relief to feel things working as well as they are again. And now that things are working as well as they are again, I can look back and say that in the months, maybe even a couple years leading up to my diagnosis, they were not working optimally.
Well, that's where your story and Jodi's story are quite different, because Jodi's digestive system has not been working and probably never will work as effectively as it did. And in fact, we were just having a conversation about, it doesn't take much to put her off balance. And we were talking about that again last night on our walk, which is necessary for Jodi's digestive system to keep working well. We've got to walk regularly. Can we move on to just very quickly talking about, because you had some significant surgery, and then you stepped into a process of chemo. Tell us about what happened there.
I was in very, very bad shape when I got home from the hospital. I remember just not feeling like I could move. I couldn't lift my head up. I remember that my husband was basically feeding me ice cream with a spoon while I was like prone in bed. It was really delicious, though. I remember the ice cream being really delicious. I had a home care nurse coming to help with various things, and I just felt like everybody was doing everything for me. I couldn't shower by myself. I couldn't really move. It was a big ordeal just to go to the bathroom, and my bathroom is basically 5 steps from my bed where I sleep. So they did have to delay starting the chemo for about 6 weeks or so after the surgery. I guess we could talk later about the vocal end of recovering from what happened to my whole breathing system as a result of that. But the chemo started, and I had to be strong enough to be able to endure the chemo.
Yes.
For those of you who don't know about chemotherapy, chemotherapy is basically poison that is trying to find and kill the cancer cells that are still in your body. And it's necessary because after my surgery, I had no cancer that could show up on any tests.
Yeah.
But the expectation is that there's still some in there floating around. And so they will prescribe a course of chemo that they think is pretty sure to get all of it. And then after you're done with the chemo, they do all these tests to see whether or not they succeeded. And if they didn't, then you have to have more chemo. But fortunately, I'm getting ahead of myself. The idea is that you're going to poison your body, but the poison is going to kill the chemo and just basically annoy the rest of you very much. So you're going to be really, really sick for a long time. My chemo was supposed to last 6 months. It lasted longer than that. It was about 8 months because I kept having disruptive reactions to the chemo that made me have to take a break from it. I think there were 4 incidents along the way that delayed the progress of the chemo. So it was 7 or 8 months of feeling sick all the
Yeah.
time,
Yeah.
24/7. I would have a 48-hour period where I would get the chemo, and then there was a 2-week cycle. So
Yes.
towards the end of those 2 weeks, I could start doing things like
Yep.
walk down the street, maybe go see a play, um, have a lucid conversation with people. I was telling Dr. Dan that one of the things that they hadn't really prepared me for is that it wasn't just my body, my cognitive ability kind of tanked. And in some ways that was worse, because there was not a day that went by that I didn't feel like I need to be telling people what's going on. I need to be talking to my friends. I need to be updating people. I need to be just on social media and seeing how is everybody else doing. And I was missing out on all of that, but I just couldn't even sit up to type. And then when I couldn't think.
Yeah.
So that's chemo. I'm gonna spare you the details, I think, of the delicious episodes that interrupted it. But what you need to know, if somebody you know is going through chemo, or if you have to go through chemo, it's counterintuitive to do something that's going to make you feel sicker for the short term. They have to give you what they call is what they think is going to be the highest tolerable dose.
Yeah.
So as much of the stuff as you can handle without it damaging you, ideally. There's no minimum effective dose that they are aware of. So they just clobber you as hard as you can take it. And I also didn't know that there was a form of cancer that would mean I wasn't going to do anything for pretty much a year. I don't know if Jodi's experience was like that, but I literally couldn't function.
I still remember the first meeting we had with the oncologist. Jodi also had a really long stay in hospital. She had some significant complications post surgery, and so once we finally got in to see the oncologist, just I think it was the day prior to starting her chemotherapy, we said, so once Jodi's feeling better post surgery, do you think she'll be right to get back to work? And I
had the same questions.
And he just looked at us, went, no. No, your life has to go on. In many respects, it has to go on pause. I do want to interject at this point. We need to, and I think it's important that we acknowledge that certainly the experience of around chemotherapy and that sort of thing is right now is very specific to colon cancer. The variety of different treatments for different cancers is, and they're getting even better at sort of really tailoring to individuals with immunotherapies and a whole. So we're not providing any medical advice or insights into how you will be treated ultimately, should this be your journey. But yes, it was, you mentioned the cognitive decline. Jodi always described it as chemo fog. She just, her brain was just, and like you, my wife is a highly intelligent human being, and I think that really, that aspect of the journey really affected her, because it did have an impact on her identity. And if you are okay with us to sort of use that to segue into talking about what was the impact on you and your person outside of the physical impact, which we know is significant.
I can't possibly talk about that in a 45-minute conversation in any kind of a comprehensive way. I felt like I wasn't here. I felt like I wasn't really here. I was here, but I wasn't. And I'm glad that when the cognitive decline set in, I was aware that it was because of the chemo and that it was almost certainly going to reverse itself once I was no longer having chemo. But it was very frightening because I enjoy my brain. I enjoy thinking. I enjoy language. I enjoy writing. I enjoy figuring things out. I enjoy researching things. I mean, I chose the right job. I like figuring out things so that I can make it easier for other people to understand. And I, I guess here's an example that I pretty much encapsulates all of it. I remember watching a number of movies and TV shows while I was having chemo, and I remember enjoying them. And then some of them I revisited afterwards and realized that I hadn't really watched the shows. I'd gotten the gist of the plot, but I missed so much of it, and I wasn't available to go on the emotional journey of it. Um,
Yeah,
does
Jody,
that does that
Jody had the same experience. She had exactly the same experience because, often the shows that she was watching while she was just literally laid out on the couch, because that's all she could do for so many days of those 2 weekly cycles. The TV's on, but I don't think you can. I don't think she could actively engage with what she was watching, and I think that's true to form of that part of the journey. What and it was actually as I asked the question that I do I I recognize that you are you're 12, it's 12 months, aren't we? Just 14 months for you post diagnosis.
yeah.
So, you are, and I want to acknowledge this and thank you for being so ready to converse about this, because it's still it's still, you're not having the chemo anymore, but you're still on the path, aren't you, to to having any sense of conclusion about what you're going through. What is the current experience for you around your voice? Because such a big, like you just said, you have a good brain. You like using your brain. I know you have a good voice too, and you like using that. What is it? What has been the impact on you vocally? Because and I know you approach voice as a very holistic thing. We are the instrument, the whole of us, and chemo is going through all of us. What has been the impact on you from that standpoint, the singing standpoint?
I have a lot that I could say about it now, but I think that probably ask me again in a year. Um, my voice was wrecked. It was completely wrecked. When I was in the hospital, I was not only, I don't really remember this, but I'm told and I believe that I was also like dealing with bronchitis because I was so run down.
Wow.
And so after the surgery, and I've never had any surgery before, but when you have a big open abdominal surgery, everything's going to be very tight in there for a while. And I literally felt like I could not breathe. Like I could take in a thimbleful of air um, after that surgery. And then once I started being able to breathe a little bit more, I still couldn't generate the subglottal pressure required to cough or sneeze. If I felt like I had to sneeze, it became like this big traumatic event because this wasn't going to happen, but I felt like all of the wounds would be reopened if I had like this
Yeah.
big sneezing experience. Um, so just not being able to do anything with your breath. And then once it started getting to be a little bit better, I was very fascinated by the fact that I couldn't really phonate beyond more of like a range of a fifth or so. And it didn't feel like it was because there was anything wrong with like my laryngeal anatomy. I just could not generate the breath pressure. Not that I needed that much, right? It doesn't, oh, I couldn't do that um, to get my chords to go. And I think about all the times that I've talked to singers who've had some abdominal surgery or gastric bypass surgery or something like that, and they just push themselves to get right back to work. And sometimes they come back to me and it's like, okay, get me in shape because I've got this gig that I have to sing. And I thought, no, you really need to find out what your body is now,
Yeah.
what it can do, what it wants to do, and accept that it might take a really long time. This was, interestingly, not the worst part of it, because as identified as I am with my voice and my singing voice and my ability to use it in a variety of contexts, I was so fascinated by the way that my body had been hacked, and that, like, oh, I have a different instrument now. How do I learn to play this one? And what am I going to be able to offer to other people once I get through this,
Yeah.
so that I can make it easier for them or manage their expectations. So it wasn't enjoyable, but it was
Mm.
very interesting to me.
I wonder if there are, and I'm not saying I wonder just so I can make a statement of fact. I actually wonder whether, because I know that you had a portacath. For those who don't know what a portacath is, it's basically it's something that gets put in under your skin. So you actually get a special inserted point that they are then can easily, well, it's often not easy, but that they can put the chemo directly into your body, and it can, it's a it's important and necessary, but it's another part, can be another rough part of the experience. And I wonder whether the impact on your feeling up top of having a sense of, rib expansion, etc., intercostal muscles. One. Number two, I wonder what impact the muscle atrophy, that I know Jody experienced quite significant muscle deterioration during her chemo, like partly because she just couldn't move. Like, there was exercise. What's that? Like, I'm struggling to get to the bathroom, which is 5 steps away, let alone, doing any significant exercise. Do you think that could have played a role as well, those two things? Like on the
Oh,
phonation side of
absolutely.
things?
Well, from um, the surgery recovery, I felt like I was being pulled down. Like, I felt like there was like a rope attached to my sternum that was pulling down, and I was just kind of curved in for a really long time until the abdominal surgery kind of healed up and I was able to feel expansive in that direction. And as far as the muscle atrophy, what I noticed after being in bed for a long time and not looking at myself in the mirror, not really understanding what my body was at all, when I finally got a good look at myself, the first thing that I noticed was that my ass was gone. Like, there used to be an ass there, and now there was no ass. It just went like flat. And I thought, it was like my butt wasn't working, so my ass fucked off. Like, I'm sorry. But that was what it felt like. It's coming back now.
Okay.
But it's really it's no surprise that I had trouble just walking down the street. I was very weak and I couldn't breathe.
And so, given that you're struggling to breathe, to form the necessary subglottal pressure to, initiate phonation, and if you have any deterioration of muscle body within the vocal folds themselves, yeah, it's obviously quite a challenge. Where are you at vocally right now? And if you can also then use that question to lead us into what has been the impact on your sense of being a singer.
Where I am vocally right now is not quite as coordinated as I was before my diagnosis,
Mm.
but I feel like in some ways I'm marshaling my resources more efficiently. There's the larger topic of capacity. I found out that capacity is a thing and that I can only do what I can do. And I thought I understood that before I got sick, but I did not understand that because I live in New York City. I don't know whether it's New York City and American culture that makes it even more this way, but I felt like I just need to drive myself as hard as I can all day long, and that's my capacity, and that is not the way that things work. So I'm being much gentler with my resources now. I would say that my vocal range, high to low, is pretty close to what it was. But I'm still sort of reorienting the way that my breathing is working. I can do enough to be able to demonstrate effectively in lessons. But the main thing is that over the course of my treatment, at first I was like going in the studio and trying to sing and trying to get better. And then at some point I just gave up. I didn't give up singing, but I gave up trying to do that. And, I tell people that 80s rock and horror movies got me through chemotherapy because I would just put on playlists and sing along with them. And my instinct when I first got sick was also to, instead of trying to really get my voice back in shape, I decided to pick up guitar. And this is my third attempt to learn a stringed instrument. It's not something that I apparently have much aptitude for, but the beginner mindset and not having the expectation that I would be any good was really therapeutic for me. The cognitive impairment made it so that I couldn't really practice that much while I was in treatment. And the weirdest thing is that I couldn't even really build up calluses on my fingers because my whole body was like, no, we need the resources for other things. But I was constantly thinking about music. I was constantly learning new things about music. I was constantly just sort of playing with my voice and making different noises with it. And I'm really glad that I decided to go about it that way rather than pushing myself to try to see if I could sing an opera aria again or something like that when there was just no need to.
Perhaps the standout thing about what you just said is that you found a use for 80s rock. No, I'm a big fan of 80s rock, so.
All right. The funny thing is that at the end of it, Apple Music, I have Apple Music streaming. At the end of the year, they give you like the year that is your playlist.
Yeah, right.
This is all the music that you listen to. And it turned out that I was even more obsessed with Steely Dan than I thought I was.
There we go.
And where that started, this is a joke that very few people are going to get, but the cognitive thing was like I started talking to myself to make sure that I was remembering to do things because I usually had somebody here with me, but my husband travels for work. And so sometimes I was here by myself. And so I came up with ways to remember to do things and to check on things. And I had a colostomy bag. You can look that up if you don't know what it is, but it meant that I was pooping into a bag that was attached to my front. And you have to let it out when it's full. And also when you fart, that's where it goes. And so I was talking to myself to try to manage my system. And I asked myself, is there gas in my bag? Yes, there's gas in my bag. Wait, that's a song. Is there gas in the car? Yes, there's gas in the car. And then that just sent me down a Steely Dan rabbit hole. And so the anthem, Apple says that my anthem for 2024 is Kid Charlemagne, which is what that lyric is from. It's a good song.
Good song. And obviously gave you some smiles while you were dealing
Don't judge me for liking Steely Dan.
That's right. Under other circumstances, we might be tempted to, but we'll let this one slide. What did you do to, you mentioned the 80s rock. Have you found any particular activity helpful or group of activities helpful in re-establishing some vocal strength and stamina?
I mean, the usual.
Yeah.
I'm much more practical about my practice now. We have this much more with Western classical music has a real sort of, the culture is much more likely to be a sort of like the master apprentice paradigm for voice
Yeah.
teaching. And I think that a collaborative paradigm is a much more fun and effective and humane way to learn and teach singing. But to the extent that I still had this idea that like, no, I have to do this exercise and that exercise, like, no, I want to sing this song.
Mm.
I'm going to sing this song and I'm going to see like, what am I noticing that I would like to be better about the song, and what do I know about singing that will make me better at singing the song? Um, and that's the way I'm teaching now too. I've gotten very interested in just this distinction between conceptual and practical slash experiential learning. And so I will always take the time to connect with a student, find out exactly what it is that they're fascinated by or the piece that they're really excited about working on, and then tailor everything that we're doing to make sure that it is meeting the goal of helping them do the thing that they want to do better. So that is a little bit of a shift.
So
Um,
have you noticed like a significant change in your approach to the way you're teaching voice now? Like, has it radically changed things for you, or can I just add it here? I'm wonderfully surprised, but also amazed to hear that you are actually back teaching already. So that's
a
exciting.
little bit. I'm ramping up. You
Yeah,
caught me just as I'm ramping up.
yeah, good.
And so like you're this moment in my life is when we're like, most days there will be a new first time since the cancer
Mm,
experience.
mm,
Just last week, I rented a zip car and I drove it all by myself to Trenton, New Jersey, which I don't know what the comparison would be with where you are, but a student of mine was performing in an opera. And I got to go to her dress rehearsal. And in some ways, it was the most normal thing in the world. And in other ways, it was like the best thing ever to get to go to an opera rehearsal in New Jersey. Um, so radically different. It feels different because I feel like I've got a handle on what's really important for myself now.
mm, mm.
And, the don't sweat the small stuff thing, I always try to support my students in expressing themselves and connecting with the music and not feeling like it has to be this way, or I have to sing this song because they said so, or I need to get this audition right. But I know on a different level that none of that matters the way
Mm,
that we used to think that it did. And
mm.
what matters is the experiencing that the experience that the two of us are having in this moment now. Um, I really just appreciate that people are willing to trust me and that I have this ability that I can help them.
Mm.
And it's hard to say, it's hard to explain what the pedagogy of that is, but it's not about making sure that your vowels are lining up. It's not about making sure that you are blending your registers well. It's about, are you feeling comfortable in your body?
Mm.
Are you enjoying the experience of making music with your body? And how can I help you enjoy that experience more?
Mm.
And
Yeah,
that's true whether it's a complete beginner who wants to do well at karaoke or my student who is singing in her very first opera in Trenton, New Jersey.
yeah. That I can see how on the surface that might not change a lot of your process, but I can equally see how on much deeper levels that can change everything about your process, can't it?
It feels different to me.
Yeah.
Before, I remember, because the echo of it is still there, I used to think that my job was to dump as much content into the student's brain as I could within the course of that lesson. but that isn't necessarily going to help them because retention and experiential understanding is important. Um, and so I find that I am constantly slowing myself down and listening and tuning into them when I'm teaching and not worrying about how, like, oh, but we have to get this aria perfect by the end of the lesson. Or I really wanted to hit this, that, and the other point, but then we went over here instead, and that's bearing fruit. But how am I going to bring us back? I'm second guessing myself less. I'm stressing out less about whether or not we're going to like get it all done, because no one's ever going to get it all done. The lesson will start, we will do it, it will end, and then there will be whatever next experience there's going to be. But how can I facilitate a really high quality learning experience for my students? Not how much content can I shovel into their brain.
People watching this will be coming at it from one of 3 points. They've either had their own personal experience of cancer or significant illness or the like. They've been a person who has walked alongside that journey, which has been my story with Jody, or they're a person who actually in very fortunately can't directly relate to this conversation, and yet I would want them to be able to engage with that type of process that you just said, because I guess the temptation for a student of voice is to walk into the lesson space and want to have all of these, let's put our running shoes on and get everything done. What can a student who is actively engaging in this scenario, with that sort of learning process that says, hey, let's just mindfully walk through this, what can they do to participate in that?
Well, they're the one who's leading the lesson. I'm just responding to what it is that they're doing and asking. What they can expect is that you can never really promise it, but I go for it, and usually the result is they're going to get something out of that experience that they will keep, they will retain. They will understand something new about how their tongue works and how that can create more beautiful vowel sounds for them. They will understand something about maybe how they can engage in a more grounded and visceral way and produce a big, powerful sound that maybe they didn't know that they could make. It's going to depend on the student, but whatever it is that they most want to get out of the lesson, I'm going to focus on that. And I'm not going to okay, we got that done, now let's on to the next thing. I'm going to reinforce that. I'm going to help them look at it from this and the other direction so that they really own it by the time they're done with the lesson. And if they look frustrated, I'm going to find out what are they frustrated about. If they feel like it hasn't happened yet, we'll see. I've been back at it for 2 or 3 weeks now, but the kind of person who's going to take a lesson with me is not expecting the content dump. They're not expecting that they're going to come in with a brand new aria and have it ready for prime time by the end of the hour. I don't know if that answers the question, but
no, there's no right answer to provide. It was I enjoyed listening to your response. So I want to, because we're coming up towards the end of our show and our conversation, and I've been trying to think about the most appropriate way to ask this, because I'll tell you what the question is, and then I'm going to put a whole heap of caveats and disclaimers around it, okay? The question is, and this is sort of a way to sort of bookend our conversation. What has cancer taught you? Now, I'm going to caveat that, because can I tell you, my wife and I, Jodie and I, grew to hate that question. What did cancer give you, right? Because cancer sucks. and we were always really reticent to give it any credit. Never want to give cancer any credit. But we do learn as a part of the challenging journey that it takes us on. What, to this point in your journey, because again, we understand, you're 14 months into it. What is your key takeaway thus far for you personally?
Well, I'll give you two philosophical things and one practical thing.
Go for it.
And I don't mind the question. Maybe I'll get sick of it eventually, but I don't mind the question at all. One of the things that happened right away is that I realized that my life is finite. I think we live in a real death-denying culture, and I have tried to be philosophical about that, but it really hit home that, okay, I'm going to have surgery now, and I'm going to have chemo now, and probably I'm going to be fine, and probably I'm going to make it, or at least I am hoping that that's what's going to happen, but maybe I'm going to die now. And I realized at that point, which I feel very grateful for, that, well, I still have a lot of things I want to do, and I have a lot of curiosity, but I haven't had such a bad run, and I'm grateful for what I've had. So when I came out of it, and I realized that, like, it's this paradox. We are aware of history that is very, very long. We are aware that the universe is very, very old, but we get these tiny little finite lifespans. And I learned to be more okay with that. And that's made me a lot calmer about everything. So that's one philosophical thing. The other, I mentioned earlier, capacity is a thing. I've learned how to listen to my body and to know when I need a rest and to know when I need to stop. Even now that I'm back to something close to my previous energy level, although my butt is not all the way back, I will lie down for a little while if I've got a break in between lessons and not feel like I have to use that half hour to, like, get all this correspondence done. And then the practical thing is I did pick up a new skill. It wasn't playing guitar, unfortunately, although I'm picking that up now. I learned to cook because cooking was the one thing that I could do. I could get out of bed and chop up an onion and then get back into bed. And then I could get out of bed and chop up a bunch of other things. And I could follow the recipe. I didn't trust my brain to remember anything. And gradually, over the course of those 14 months, I learned, and I'm a really good cook now. So that's what cancer gave me.
Well, the gift of food is a wonderful gift. So that's good. I just want to share a comment from Mila, my student, who was in the studio this morning. She's just written this comment in the chat. Claudia, you rock. I think it's the thirst for life we get from cancer experience that makes us loving experiential learning rather than studying theory first and applying it later. So that's wonderful. Thanks, Mila, for sharing that. Thank you, Mila. That comment. Claudia, I just want to. We do have to finish our conversation, but I just really want to, on behalf of the Voice Essentials community and me personally, I want to thank you for coming on to the show. I know this is the first time you've had the opportunity to talk about it in this sort of context publicly. And so I want to thank you for trusting our community to have that conversation. And my hope is that it is an encouragement to others who are perhaps traveling a similar journey or who might travel it in the future, because that's the one thing none of us know, do we? We don't know what's around the corner. You and I didn't know if this was going to be a part of our story, and neither of us would have suspected so, but yet here we are. And I know that as hard as the journey is, you and I are very fortunate to both live in Western countries where we had access my wife and you had access to really top rate care, and so we're very fortunate in that as well. And my hope for you is that your journey continues to be a really positive recovery. I'm so pleased to hear that you are starting to get back into the teaching, because I know how important that is for you. And thank you for sharing your story around the impact that it's had on your voice and where that is currently at. So thank you. Is there any last comments or insights that you wanted to leave us with before we finish?
Sure. I'm just remembering something that I experienced about a year ago when I first started finding out, like, what is the state of my throat and what can I do? And the first time I was able to actually phonate and match pitch, probably with a stupid 80s rock song.
Steely Dan.
I was so excited. It wasn't Steely Dan. It was probably the Eagles.
Okay.
Sorry. 70s.
Yeah.
But I was so excited, and I thought, this is amazing. This is the most amazing thing. My voice is amazing. And that's what I want everybody to know. Your voice is amazing. What you can do right now is amazing. You want to get better? I'm happy to help you. Dr. Dan can help you. You can help yourself. But isn't it cool? Isn't it so cool that we can play our bodies like a musical instrument and express emotion through sound just with our bodies?
Yeah, that's
even
wonderful.
When you can't do very much. It's amazing.
That's wonderful. Yeah. And I don't think we could leave the conversation on a higher inspirational note than that. So thank you very much once again, and let's aim to do it again in 12 months and to check in with how things are going and how much further your journey has continued.
I would love that.
Thanks again.
Thank you, everybody.
Well, there you go, everyone. That was a really special conversation. It's a very different conversation than we typically have here on the channel. But we're a community of human beings first, and singers second. And I think that was a really wonderful conversation to have, and I hope it's been an encouragement to you. That that we don't go through these things alone. My hope is that you don't go through it alone, that you can go through it with loved ones who are there to support you, if that's the journey you're on, the path that you're having to walk. But also we as a community here at Voice Essentials can play our role, albeit we're an online community, but hopefully even conversations like this go some way to providing some encouragement to you. Thanks for tuning in. Next week we are going to get back into the usual run of things where we'll be doing a webinar, and so make sure you subscribe, hit the white bell icon to get all the the notices to remind you that the show is happening. It happens every Monday at 1 o'clock Australian Eastern Standard Time, and we look forward to seeing you again next week. But I do hope you all have a great week. I'll see you again soon. I'm Dr. Dan. Sing well.